The second controversy is cardiovascular risk. And many of you may be aware with this. There was a significant amount of concern at one point that testosterone may cause a heart attack. So I'll put this in the context of a story. It was very interesting. Molly Shores in 2006 published a very nice study looking at men at the VA. And what she found was that those men with lower testosterone levels were much more likely to suffer from earlier death. They died earlier or sooner than men with normal testosterone levels. And if you look at the studies following the Molly Shore study, they were prospective studies, larger studies, all finding the same thing. Those men with lower testosterone levels tended to have an increased mortality. And if you look at the right-hand column, the cause of death seemed to be cardiovascular death in many of these studies. Prior to 2010, there were also many studies suggesting that giving testosterone may decrease the risk factors for cardiovascular events. Risk factors meaning obesity, metabolic syndrome, diabetes, cholesterol. So again, they may have some beneficial effect in decreasing the risk factors for cardiovascular disease. We conducted our own review and we looked at every single article we could find from 1940 to 2014. We found over 200 articles addressing testosterone and cardiovascular disease, the majority of these studies being favorable, again suggesting that low testosterone is a risk factor for cardiovascular events. And we could only find 4 studies suggesting that testosterone may increase cardiovascular risk. Now, these are the 4 studies.